Hello, everyone. My name is Dr. Jamie Brown, and I will be presenting my poster titled Health Disparities, Preventing Chronic Kidney Disease and Its Progression Among BIPOC Communities. So first, looking at the problem. So there are actual disparities in the incidence, prevalence, mortality, and also morbidity of kidney disease among Black, Indigenous, and people of color, also known as BIPOC communities. There are also many disparities that are related to the actual social determinants of health, as you can see on the slide here, such as healthcare access and quality, neighborhood and built environment, economic stability, social and community context, and lastly, education access and quality. So a little background. So chronic kidney disease, also known as CKD, as we know, it is a major public health problem. Also, BIPOC experience health disparities, once again, in access, burden, and care, which lead to having poor health outcomes. Actually, though, the highest rates of diabetes and also hypertension, which we know are the two leading causes of ESKD, also known as end-stage kidney disease, are among BIPOC communities. But then even regarding that, CKD and ESKD represent one of the most notable examples of health disparities in the country. So here I provided a case study of a young African-American female who came into the ED. She provided history of her present illness, also, her past medical history, even her family medical history, and also her medication that she takes. But overall, it come to find out that throughout her time seeing a healthcare provider, she was late regarding being diagnosed with CKD, even having a family history of ESKD. So regarding her, this case study here, it shows an example of health disparities. So looking further detail into the discussion, first, let me say that from prevention to detection to equitable access to care, we are not all treated equitably when facing kidney disease. And even regarding that, that can be due to the lack of access to care, food, and safe drinking water, even think about your patient's safety concerns in their community. Are they, even safe to walk in their community? Also think about, poor education and employment opportunities in their community. These things here can and are linked to poor health outcomes. But yet, numerous studies have also highlighted and shown that individuals with an increased number of negative social determinants of health have a higher incidence of CKD, increased progression of ESKD, and inadequate dialysis treatment, reduced access to kidney transplantation, but then also, lastly, they have poor health outcomes. So what might be some of our outcomes regarding this issue? So strategies for reducing and implementing healthcare disparities, they must be implemented to help alleviate inadequacies among the BIPOC community. Also think about the interprofessional team. They also must practice cultural humility, recognize the impact of structural racism, consider strategies to increase awareness, such as, teaching about hypertension, diabetes, and just overall increasing awareness, of CKD and ESKD. Also understand the impact of those social determinants of health. But then also promote diversity to improve health outcomes. And by that can simply be just, having a diverse interprofessional team. So in closing, we as nephrology nurses, we must increase our awareness and also our education of health disparities to address the many challenges of kidney disease to achieve health equity among the various environment in our various patients. Also understand the basics of the social determinants of health, reducing health disparities, also advancing and advocating for health equity is also important. Also improving health outcomes, as we know, can help to prevent CKD and also its progression among the BIPOC community. And that here, as you can see, shows the various references that I have provided for you. And if you have any questions, please feel free to contact me at my email address that is provided for you. Thank you and have a great day.